All right. Thank you so much for joining the webinar, for everyone joining us live and also watching this recording later down the line as well. So I'm Paulina, I'm the co-founder at Dama Health. I'm a physician by training, and we organized this webinar because we believe that we need to talk a bit more about using clinical AI in practice. We talk a lot about clinicians vibe coding, or we talk a lot about benchmarks, but there's not so much conversation about how to practically use it day to day from clinicians who are also using it day to day and making the most out of it in their practice. So that's why we're excited to hear from Michele, who is an early adopter of AI in clinical practice and will be leading the webinar today and showing us some case studies of how she uses it day to day.
Next slide, please.
Awesome. So to start with a bit of context and introduction to Dama Health, Dama is on a mission to support personalized care and precision prescribing in female hormone health, and we're building the intelligence to do just that. As well at Dama, we do novel research into this field, looking at closing the data gaps in women's hormone health. We're looking at how genetics impact individuals' response to hormonal treatments, who responds to treatments, who could develop side effects. So we are doing everything from the research all the way to bringing it into clinical practice as well. So over the years, we've been building data sets and clinical expertise in this field, and we recently launched this AI tool that is specialized for female hormone health called Dama Assist. What makes Dama Assist quite unique and special is that it's the only agentic system that is specialized to this field. It searches through evidence beyond PubMed. It also looks at international guidelines, medication databases, and our specialized clinical knowledge as well of expert consensus documents to give you the answer that support clinical reasoning. So Michele will be using Dama Assist to demonstrate some use cases and her prompts today. But this webinar is not meant to be a kind of a product demo. It's meant to be really practical session with Michele. It's really not, again, going extreme and vibe coding, but actually focusing on what can help set your kind of AI workflow day to day. So over to you, Michele. Actually, yeah, perfect.
Thanks. Thank you so much, Paulina. I'm Michele Wagner. I'm a board-certified residency-trained clinical pharmacist and founder of Parker Pharmacy Consulting. I've been practicing for over 15 years, learning medication therapy management and managing various chronic disease states. I became passionate about using AI as a clinical co-pilot or thinking partner to augment my workflows and efficiency. So I've created some structured clinical prompts for polypharmacy in various chronic disease states that have really saved me a lot of time. So why AI and hormone health? Well, I've tested several clinical decision AI tools, and Dama Assist really rises to the top when it comes to women's health. Perimenopause is underdiagnosed, undertreated, and it requires nuanced clinical decision making. And if you use AI tools like Dama Assist that is specialized in women's health with structured prompts, you can deliver high quality care in fraction of the time. Next slide, please. So the agenda for today is we're going to discuss why should clinicians care about AI in clinical practice today. We'll talk about the limitations of using AI and common mistakes that people make. I'll review my 3-layer clinical AI workflow and demo some live patient cases. And finally, we'll discuss why specialist tools matter. So why should clinicians care about AI? Well, AI is here and it's here to stay. I'm sure many of you have probably practiced using some AI in your personal and professional life, but it's really not going anywhere. So I think we should focus on AI fluency and how to use AI safely and effectively. AI can also be used as a clinical decision support tool. I like to think of using AI in this way as I always have a resident on rotation with me. And I say, hey, go work this patient up for me. And it does. In under 5 minutes, it's a great starting point. And then I am the clinician. I review the outputs and decide what fits this patient today. And it can help you improve your efficiencies, which can also reduce burnout and overall help you provide personalized patient care in a fraction of the time. So while there are many benefits of AI, we all have many concerns about the use of AI. And I think as healthcare professionals, our number one concern is HIPAA compliance. So I would never, ever enter PHI into any AI tool. I know some of them say it's safe, but I don't trust that. And I don't see the need to enter PHI into AI tools. And then there is the concern for hallucinations or incorrect information. And that is a concern. The better you prompt the AI, the better your output will be. So the better you get at prompting, that way you can lower your risk of hallucinations, but it is important to review all outputs and be aware that AI can make mistakes. And there's the concern of loss of clinical judgment or over relying on AI or de-skilling. And I just look at AI as another tool in my toolbox. I'm not relying on it. I'm not relying on the outputs. I'm verifying everything against guidelines and my professional judgment. And then you should be aware that there is a potential for bias. So the AI is only as good as the data that it's trained on. So if there's bias in the data, there will be bias in the outputs. Next slide, please. And then a lot of people have environmental concerns. AI does use up a lot of energy, water, and carbon emissions, but you may be surprised to know that AI's overall footprint is actually relatively small compared to other sectors like aviation and shipping, and even video streaming. So 1 hour of Netflix video streaming is equal to about 200 to 400 AI queries, and 10 minutes of scrolling on TikTok is roughly 20 to 100 AI queries. So there are environmental concerns, and we should learn how to use AI judiciously. Next slide, please. Okay, so with all that in mind, I came up with this clinician's AI code of ethics. And number 1 is never, ever, ever enter PHI into AI tools. It's just not necessary, and it's too risky. Number 2 is use AI as a clinical decision support tool, not a decision maker. You are the clinician. You decide what fits your patient. Number 3 is verify all outputs against primary literature, clinical guidelines, and your professional judgment. Number 4 is evaluate, recognize the limitations and potential for bias in AI-generated content. Number 5 is follow all institutional, legal, and ethical standards when using AI. Number 6 is maintain accountability. You are the clinician. You will be held accountable for your patient outcomes. And number 7 is be transparent. Let the patient know that you're using AI and get their informed consent. So let me give you some examples of how I see clinicians using AI not most effectively. So number 1 is poor prompting. If you use a vague one-line question, like how do I treat a perimenopausal woman, you can get a generic or even potentially unsafe output because you're missing so much context. The more context you give the AI, the better your output will be. And number 2 is knowing which tool to use for which situation. So personally, I would never use a generic ChatGPT tool for a complex or nuanced patient case. And any AI tool I use for a complex or nuanced patient case, I'm going to be evaluating that output very critically. And number 3 is not having a structured workflow. So if you have a structured workflow, and I'll show you this, it can really improve your efficiency and reduce your mental. So I just wanted to give you an example of a poor prompt, and what you're really missing is a lot of context. There's no safety framing, and you didn't give it an output structure. So if I can share my screen here really quick. Let me show you an example of what this could look like. So if you can see my screen.
Yeah, all good.
I have the Dama Assist tool put up here. And I've created this folder of some examples. So I put the poor prompt in, which is what hormone therapy should I give a perimenopausal woman with hot flashes? And actually, the Dama Assist tool is so good, and the prompting behind this tool is so good that you'll see the output is not as vague or bad as we would expect. So they already have safety framing in the background. So even though we didn't ask for that or mention it, they are going to tell us assess for safety and contraindications first. And then it's going to give some options because we didn't give it a lot of context. So it's like, if the patient needs contraception and symptom relief, here's some options for you. If the patient needs symptom relief only, here's some options for you. But I will show you how we can make this output even better with a better structured. Okay. So now let me go over my workflow, how I've been using AI. So next slide, please. Okay, so number one, I set the context. I'm going to prime the model. Any information that I need as a clinician to make the decision, I'm going to give the AI. So if you can click, I'm going to assign it a clinical role. I'm going to say you're an expert in women's health. Give me a comprehensive overview of this patient. I want to specify which guidelines I wanted to look at. I'm going to give it all the structured patient data it needs. And I'm going to set boundaries and constraints. So safety is always first. Number two, I'm going to give it step-by-step reasoning, just like a clinician would. Walk through this patient, work them up just like a clinician would. As a pharmacist, I'm always looking for drug interactions, side effects, and risks with meds. And I'm going to ask for the output to be assigned by clinical importance. And then number three, really the most important, is verifying the output. You don't just take this output as black and white. You have to apply it to your patient today. Okay, so I've created a structured prompt, and this has really saved me a lot of time. And I will show you an example of this prompt, but it's basically going to have all these components that you see. And so the role, the patient info, clinical assessment, treatment plan that's comprehensive with hormonal therapy, non-hormonal therapy, genitourinary, cardiovascular and bone health, sexual health, and lifestyle recommendations. I'm always going to have a med review as a pharmacist and an action plan. So next slide, please. So let me demo some live patient cases and show you what this looks like. Okay. So case number one, we have a perimenopausal woman. She has hypertension and dyslipidemia. I said she had uncontrolled hypertension with a blood pressure of 140/88 and dyslipidemia with an LDL of 190. She's having 7 to 10 hot flashes weekly, night sweats, sleep disturbances, mood changes, and fatigue. And our key questions are, is systemic hormone therapy safe given her hypertension and dyslipidemia? And if so, which formulation would we choose? So let me share my screen, show you what this looks like. Okay, so I'm going to start with my prompt. This is an example of what the prompt looks like, and it's very detailed. And in here is where you put all the patient info. So it helps to put all the patient info in and then copy this whole prompt and put it in the chat box. And it's a full workup, a comprehensive workup. So that's what I did. So I took that patient, I copied my prompt, I put all the patient context into this very long prompt. And now we're going to get a really structured, comprehensive output. So it's going to give us a menopause stage assessment, symptom analysis. It's going to tell us, okay, is hormone therapy appropriate for this patient? And it says she has no absolute contraindications, but she has precautions and risk factors with her obesity, her dyslipidemia, and her uncontrolled hypertension. And it says, well, these are not absolute contraindications. We really need to think about the route and the risk to this patient. So we should avoid oral. And it does say that we could try transdermal estradiol. It's going to give recommendations for progesterone. She does have her uterus intact, and it gives us options. It always evaluates genitourinary symptoms because that's in the prompt. And it's important to note for vaginal dryness, vaginal estradiol is safe. There's not really meaningful systemic absorption. So it is safe for this patient. And then I love the cardiovascular and bone health assessment. And this is really important. She has an LDL of 190. Really, she should be on a statin. And for bone health, it's saying DEXA scan is not indicated for her at her age without secondary risk factors. It's going to give sexual health considerations. medication optimization. So she should be on a statin, and maybe we need to optimize her blood pressure medicine as well. Monitoring and follow-up plan. And here's our prioritized action plan, and this should be ranked by clinical urgency. It gives a patient-facing counseling summary, which I really love, and clinical summary for documentation, which hopefully helps save you time. So I just love the comprehensive overview. It's a step-by-step workflow. I'm not going to miss anything. I'm doing the same steps every time. And then I'm evaluating the output and deciding what fits for this patient today. Okay, so then the next slide, this slide just summarizes the output that we just reviewed. And so case number 2, this is kind of an edge case. We have a perimenopausal woman. She has a prior DVT. So if we look in the patient profile, she has a provoked DVT about 5 years ago. It was post-op. And she's no longer on anticoagulation. And her symptoms are listed here. And you'll see she's having hot flashes, night sweats. She's also having genitourinary symptoms. And so the key question here is a history of VT an absolute contraindication to hormone therapy in this patient? So I'll go back to sharing my screen, show you how I put this one in. So I'm using the same workflow. I use my comprehensive prompt and enter the patient information into this long prompt. And let's review the output and see if we. So it's going to give menopause stage assessment, symptom analysis. What I really want to know is hormone therapy appropriate for this patient? And it says it's potentially appropriate, but requires shared decision-making and nuance. And I love that it calls that out. This is a nuanced case. And she has a history of a provoked DVT over 5 years ago. And I love that it's going to tell me these guidelines in the labeling says this is a contraindication. But these guidelines of current evidence says perhaps we could try a transdermal estrogen. We should avoid oral estrogen, absolutely. But transdermal estradiol does not alter the coagulation cascade. It does not increase VTE risk of a baseline. So it's saying we could consider it. I really love this statement here. It's telling us it's off-label. And somewhere in here, it does recommend, maybe you should do it, here it is, a hematology consult, which I really love that. They said that as well. And then it's going to give me treatment options, transdermal estradiol, different formulation choices there. Progesterone is indicated. She has a uterus. It's going to talk about non-hormonal therapy options, which is important for this patient. Genitourinary symptoms are safe, and we can initiate those immediately. If you want to do like a vaginal estradiol, that is safe. And it does her cardiovascular and bone health. So you can see it's following, this output is very similar to the last output because we're using the structured prompt in the structured workflow. And so it's going to go through all the same things as the last patient case. So I just really like this to streamline my work. Okay, and then I have one more patient case to show you. And this slide just summarizes that output that we just went over. And the next case is a conversion case. So we have a patient on an estrogen patch who wants to switch to a different formulation because the patch is irritating her skin. And I want to show you this amazing tool in Dama Assist. This is a very unique tool. And they have a hormone therapy conversion tool. So she was on the twice weekly patch, and I believe the low dose, and then it's going to give us the equivalence for all these different formulations, which is amazing. And I love this clinical note down here. It's going to tell you how they got this. It's a compilation of consensus guidelines. They do say that this does not represent strict pharmacokinetic biological dose equivalence. Individual absorption can vary, so always titrate based on the individual and their response, but it gives you a great starting point. So I really love that tool. It's really unique. Okay, so the next slide, please. Okay, So I think it's really important to always verify outputs. You always want to check the guidelines. Do they line up? Go to the guideline. If you're not familiar, find where it says what it's recommending. I do that whenever I'm unfamiliar with the recommendation. I verify all dosing, especially if I'm unfamiliar with the FDA labeling and prescribing information, because AI can make mistakes. And then I think it's important to cross-check drug interactions as well if you need to use lexicomp or micromedics to double check something. And then finally, apply your own clinical judgment. So does this fit this patient today? What is the patient value? You decide. Thank you.
Amazing. Thank you so much, Michelle, for sharing all of this. And I always say context is everything. And AI tools already save us a lot of time. That extra step of optimizing your prompt, optimizing the context, it really does make a big difference on the outputs. And sometimes I get comments around like feedback on the outputs, and it's often a good thing to go back and forth a little bit with the AI, right? Of like actually push back and like as you said that with a president or a peer, you would give them the context and then you would go back and forth a little bit. So I'll tell you a bit more about what we built, Dama Assist. And first things first, don't get me wrong, obviously, Claude and ChatGPT and all these tools are incredible. But basically the story is that our medical advisory board was telling us that despite the clinical adoption of these AI tools, they were not using it yet for our field, women's health, hormone health. And we looked into this, and actually there's been studies done to show that the accuracy of these tools is generally obviously amazing in women and medicine in general, but often those benchmarks are testing against internal medicine, general medicine. And there was one study that looked at menopause specifically, and the accuracy and the performance was much, much lower. So we realized not only obviously the feedback adds up, it's not actually helpful at the point of practice, and the evidence was also backing that up. So our medical advisory was right, like this field actually does need a specialist tool that is really optimized for this use case. So before showing you exactly kind of the comparison, I'm rather just go back to the quotes. Instead of showing you all these features, I wanted to start with showing you these. So these are the actual feedback that we got from the very first users of the platform. And this is also what I personally needed to be convinced as well that this tool was really needed, just feedback from users that use it at point of care. So getting really positive feedback around efficiency, but also being more confident in prescribing, making those decisions, approaching hormone therapy conversations. We know a lot of people are just picking up that as well because of the lack of training for many, many years. And it's just a tool that has everything in one place. But there's really one quote on the top right that really made my day when we received it. It was about how impactful it was for the practitioner in terms of patient outcomes as well. So I would really encourage everyone to give it a go. Of course, we have a free trial, so would love for you to experience it. So let's go to the specifics a bit more. I wanted to show you a bit of a comparison across the different tools. And to be honest, it's not showing about, is one super superior to another one generally. It's really showing you what a specialized tool is and what does it mean for AI tool to be specialized. So again, OpenAI and Open Evidence and ChatGPT, all of these tools are brilliant and we can use them day to day. I use Claude day to day for day-to-day things. But in practice, what does specialized actually mean? So the way I think about it is that there's brilliant generalist physicians as well, but there's also fellowship trained subspecialists. And when you have a nuanced edge case, you often want to ask that specialist. So the same way I think about AI tools, and there are those specialized AI tools in the industry. There's AI legal tools, there's AI tools for medical students. So we are seeing those specialized tools come up more and more and more. So general tool answers based on their general knowledge. So depending on your context and the prompting and their data sources, that's how they will answer. So as Michelle mentioned and explained, Dama already knows and has the context of what it's supposed to do. So of course, it's great to be really good at prompting, but you don't have to be an absolute prompt engineering wizard. You don't have to be super technical to be able to get good outcomes with Dama Assist. So it already knows what matters, what to prioritize, and what evidence to use as well. It's grounded in the sources that really matter for our field as well. So society statement and guidelines, international ones as well, to really be up to date, research papers, and it directly links to the FDA database as well, so that it's more accurate on those dosing and formulation questions for you as well. So instead of going to the leaflets and taking a lot of time to check all of that, it's directly pulling from the sources already. And when there's a guideline lag or we just don't disagree, there's a lot of disagreements in this field, we actually have consensus documents and those expert guides that talk about the nuance and the different approaches. So what does a longevity doctor do versus what the guideline says? So you actually get to hear the whole perspective and make the decision for yourself as well. And every answer will have citations, so you can always trace everything back to the evidence and the exact source as well. So Dama also knows the clinical reasoning. Is sometimes not the most important actually part for your day-to-day practice in terms of time consumption. So often it's patient counseling, it's often writing referral letters, it's sometimes patient education. So beyond the clinical reasoning that you can do with AI, there's a lot of handouts and templates and notes and things that are ready to go. And there's a special mode as well to write patient counseling scripts and patient education handouts as well. So as we test and develop Dama, it's really all about improving it against women's health and hormone therapy specific rubrics and benchmarks that we had to develop as well, because they're not really out there in the industry rather than general medicine benchmarks. So we have very specific, really high bar in terms of how we test the answers as well. So overall, it's already built around workflow of a clinician working in women's health. If we go next, I think this is now time for Q&A, and we have some questions coming in, which is amazing. You can put them in the chat, and there's a Q&A section as well, so we'll try to go through everything. And we received a few questions to address as well before the webinar. The main one that I think everyone is debating currently on LinkedIn that we wanted to chat about a little bit is the Nature paper, talking about how general LMs were more like the performance was better against a specific benchmark rather than the specialized clinical AI. And they looked at up-to-date and open evidence. And open evidence responded as well, like addressed this officially. So huge debate. I think there's a huge debate around the methodology specifically of the benchmark that was used. And open evidence made a whole official statement pointing out issues with the design of the study as well as potential conflicts of interest. And generally benchmarking, doctoring and benchmarking clinical practice is really very hard because obviously it's not like a medical exam, right? We know in medical exams, there's one right answer. It's often like closed questions. Like real life is not like medical exam. And I think we have this similar problem to benchmarking those AI tools. And I think we will be arguing about that for a long time. What I actually pay attention to a lot with those benchmark is that often they really focus on internal medicine, often primary care, other fields of medicine. When it comes to women's health, they often have some OBGYN sections of rubrics, but very, very little is around like menopause prescribing, specifically hormone therapy prescribing. So when I often look at those papers, like I sometimes just doubt whether hormone therapy was even part of the benchmarks in the first place. So even if a paper concluded that something was really great, I don't know if it was great for the whole of medicine or was actually great for female health as well. And generally what those papers tell me that the general performance of these tools are obviously improving, but I do think there is a case for specialized AI tools. We can see that from other companies like Aura as well. They invested quite a lot in building women's health specific AI tool as well. And at the end of the day, exactly as Michele said, that tools are tools. So it really depends how you use it, how you prompt it, how you go back and forth with it. And that's going to be the impact on your clinical practice and the patient care. So you can imagine that I could memorize every medical textbook in the world, but that doesn't make me the best doctor in the world, if you know what I mean. So it's kind of the same with tools. So I basically, obviously, will believe that there is space for specialized tools. As I mentioned, there's specialized tools for lawyers, there's specialized tools for specific purposes. And I think you can achieve better impact when you do a specialized tool in women's hormone health. Michele, would you like to add a bit more on this topic?
No, I agree with everything you said. There's a potential bias concern. There's concerns about how do you evaluate AI tools and the benchmarking. There's concern about contamination of data. Did the generalized LLM models already see the questions? Did they already know the answers? So there's a lot of questions about that study. I think overall, the results are probably overstated. But I have to say, from trying out many clinical decision AI tools, that open evidence and up-to-date expert AI are my least favorite ones. So I'd really love to see how that study would have compared Heidi Evidence, EvidenceMD, DocsGPT, Dama Assist, like other tools, because of all the tools I've tried, truly open evidence and up-to-date are my least favorite ones. So
interesting, yeah. Having as we had on the table, I think open evidence is an incredible PubMed retrieval, and that's how I use it now. If I want to look up a specific paper, like I know the content will just up in in open evidence if they had agreement with the journal. So yeah, different purposes, I guess, right? Tools, exactly as you said.
Yeah.
We got a really good question in the chat as well from Erica, asking about if we have nuance, real world practice, and pearls, because some guidelines are really strict. And 100%, this is one of the reasons why we developed this tool. And depending how you context it, how you prompt it, we have longevity physicians using it, and we have people working like health systems that have to adhere to very strict guidelines. So it can help you reason through all these different approaches. And we have this layer of like expert guides and clinical consensus documents that also kind of show those different perspectives. So the guideline says this, actually, internationally, for example, testosterone prescribing is no longer off-label in these geographies, and this is the guideline that they use. And then longevity clinicians use this approach. So then you can kind of compare and, again, make your own decision at the end of it. And you also mentioned that it's a great option for providers that are not menopause society certified practitioners. And correct, but we actually have people using it that are experts and non-experts. So we have a lot of non-experts who are starting to use starting to train maybe for the certification, or just starting to prescribe hormone therapy. And we have also a lot of experts who are actually menopause society certified practitioners, because you have to keep up with the evidence, the knowledge, you have to produce all the patient content material. So we have both, and they just use it differently. Yeah, different kind of use cases and different tools matter to people at different stages. And then Erika also asked about supplements. Yes, this is one of the most common prompt as well that users ask. So does this include supplements and vitamins? We have a whole specific tool for supplements as well. It's pulling data directly from NIH. And you can also ask questions about supplements, and specifically if it's helping with hot flashes and if there's data and evidence behind a specific supplement, and then create a handout on the topic for a patient. Very, very common as well. And then we have a question from Susan, menopause in the UK, treatment options and drug names relevant to the UK. So right now, the main database we are pulling from is FDA. We do have in a roadmap to create a specific API to the medication databases in the UK as well. However, the medication switcher that we developed is international. So you can choose, we have Australia, we have Canada, UK, and US, and you can switch the different dosage and formulation. But yeah, on our roadmap to add the UK one as well. And then we've prepared another question that we had about the verification of medication dosages and formulation. This is something that I wanted to chat to you, Michele, because this is one of the most common errors we see AI make when, it's instead of mg, it's g, the units are not correct. And it's very easy when the rest of the answer is super good to just kind of go for like, oh, this must be good as well, the unit and the medication dose.
Yeah, so anytime you're not familiar with med that you're not used to prescribing, I would go to the prescribing information and double check it. Because I have seen errors. I've seen errors in open evidence that have surprised me, to be honest.
Yeah, this one's super common. I think it's just that the AI is not being that good with numbers as they are with knowledge. So that's why we have that very direct integration with the FDA leaflet. So you can click on the citation and it's going to open up straight away that leaflet, the prescribing information. So you can see directly where the data is coming from.
And then there's drug info resources like LexiCode or LexiDrug and Micromedics. That's what pharmacists rely on.
Amazing. Thanks, Michele. And then we also had a question about the conflicting information in this field. There's a lot of conflicting information. I think part of it is that you can go through those different approaches with Dama Assist and come up with what actually suits you and what you think aligns with how you practice. But Dama Assist is already pre-trained to prioritize the latest information over them older guidelines and over publications. So recently published guidelines and also recently published data, like analysis of certain studies rather than the initial conclusions. And if there are specific gaps and topics that are just not been addressed in those guidelines, we write those additional consensus documents and expert guides. And that's just the part that is, you can't find it on open evidence, you can't find it on Google. It's just extra input that we include in Dama Assist so that this tool becomes more and more specialized and even better in this field. Let me see if there's any more questions. We have like a few different things. There's a Q&A, there's the LinkedIn. I'm so sorry, everyone, for the confusion with Zoom. This is the first time we are doing the LinkedIn Live, and Zoom is always just trustworthy place to do a webinar. So thank you so much for shifting to Zoom, much appreciated. Okay, I think that's everything in terms of questions. We have a few gifts for you. So in June, we have a June discount for Dama Assist. There's always a free trial because we always believe that it's good to play around with the AI tool first, so you get an idea of how it works. So there's a 2-week free trial. And then if you use the June 15, you get also additional 15% off Dama Assist. And there's a link in the chat as well. And then Michele also has prepared her prompts, and I would really recommend you guys checking it out because there's different prompts for different use cases. So it's also just a good way to learn how to structure a prompt and how you might think about structuring your prompt if you want to create some as well for different use cases. So I'm gonna add the link in the chat as well to Michele's prompts.
Thank you.
Thank you so much, Michele. Is there anything that you wanted to share in terms of where to find more resources from you and where you share your usual insights and everything?
Yeah, I share a lot of insights on LinkedIn, but I'm working on and developing a clinical prompt library, and it's available at michelewagner.com.
Amazing. Thank you, Michele, so much. Yeah, you can find us as well at Dama Health or Dama Assist. We have 2 websites, and we're also on Instagram and LinkedIn, where we share tips on using clinical AI and using Dama Assist as well.